Hi, I'm Jill Snider, and I'm a fourth-year nursing student at the University of Windsor. I've studied here and found my passion between arts and science in the nursing program. I love health sciences, and the topic that I pursue, I like to call it Victory City. It's what I would call an innovation between arts and science for the betterment of youth and young adults in mental health and illness treatment. My background as an artist, I started at WCCA through Walkerville, and I learned so much about myself and about my classmates through that program, and it was very helpful and almost healing and protective for those who had mental illness and suffered from a variety of issues in their family life, their home life, school life, and gave us a way to have an outlet to speak about our problems. So one of the gaps that I've found in literature on this topic is that most treatment plans combine medication and counseling, and there's kind of a gap there where that's where mental health treatment ends. So the whole goal of mental health treatment is to have these young people grow up to live healthy lives and be productive members of society, and we're not integrating that social aspect and that psychosocial communication and involvement and inclusion into our treatment. So what I thought I would do is create a program for these students to be part of an arts community and have the support of their medical community as well, with nurses and doctors and counselors, and to really take a group approach to that. Unfortunately, with adolescents, they are the highest group for suicide attempts, and that is the basic age of onset for most mental health conditions is from the age of 13 to 25. So for these young people, they're at risk every day, and there's many factors that play into mental health, such as your home life, your income, your education, and we really need to provide for people in that way. So one of the things about the arts community is that idea of inclusion and of looking for solutions outside of yourself by exhausting these ideas through the use of paint or photography, and really being able to communicate what's bothering you without feeling so vulnerable. So some of the measures that I want to look at with this group, including students who have mental health, know someone who has a mental illness, or are sick themselves with things like bipolar, depression, anxiety, eating disorders, etc., and look at their satisfaction with the program. Do they enjoy the counseling, the mentoring, just the arts itself as a way of making them feel purpose in their lives? And looking at Likert scales and seeing what is the reoccurrence of suicide ideation. We know it's common in adolescence, but how can we stop suicide ideation from becoming a suicide attempt? And how can we prevent students and young people from making the choice to attempt more than one time in hopes of being successful? How can we change these things for them? And how can we fix the gaps in healthcare that stop us from treating our patients from a human aspect rather than just behind a desk in office visits, counseling, and not really getting to know that person and how they live day to day? So these are the things that I really wanted to look into. My reason is because of a friend of mine who did commit suicide, and I just don't want to see this problem keep occurring and getting worse, and seeing so many young people suffering when they could be enjoying their lives and being very happy and very successful and feeling like they're a part of something bigger.